Tēnā koutou katoa. It's an awesome privilege to be here today, and I just want to thank you for the opportunity to speak about Mātai and tell you our story. My name's Lee Potter. I'm the Chief Operations Officer for Mātai Medical Research Institute. And in a nutshell, we've been successful in bringing research out of the ivory tower, bringing an MRI machine out of the ivory tower and putting it into the region Tairāwhiti. So I just want to share a very magic milestone for us this morning. So at about 9:30 this morning, we finally got our 3-ton or 3.5-ton MRI craned and into our modular. So there'll be a few beers to be had at Sunshine Brewery this afternoon. But importantly, I think that this is a great opportunity to celebrate a tech startup in this region, which is Mātai. So again, I'm just going to step back a little bit and give you a little bit of background about me and how I made my way into Mātai. So I have a clinical background. I've spent over 20 years in radiology. The last 10 years of that was managing the radiology service. I was definitely one of those people at the bottom of the cliff, catching those that were falling off. And over that time, I observed that the demand in the clinical world continued to increase. In the last few years, there's been a lot of discussion around prevention, and I was struggling in radiology, which is very much involved with treatment and diagnosis, to understand what prevention looked like. And I truly believe that we need research to help us to understand what prevention is. Also around that time, and I'm probably thinking it's over 3 years ago now, Dr. Samantha Holdsworth walked into my office and she shared a very ambitious vision of setting up a medical research institute in Tairāwhiti. And when she walked out, I kind of thought, good luck to her. But I couldn't help but be drawn to her vision, because I really wanted to make a difference to the health and well-being of our community through what I was seeing. And Samantha's idea gave me the opportunity to contribute in a different way. So I left a very comfortable and secure job at the DHB, and I decided to take a leap of faith in this startup called Mātai. And a small group of us got together and we celebrated what I just showed you before, putting an MRI machine into Tairāwhiti. There's pretty much, for us for now, there are 3 priorities. And I talked to you about my background in radiology because I think it's very important that we collaborate with clinical and research. Clinical and research quite often operate in silos. And it's very important to Samantha and I that we make sure that the work we do in research is going to make a difference in the clinical world, to make sure that we're having impact research. And we believe that to do that, we need the scientists and obviously the clinicians talking together, but we also need to make sure that we're involving our iwi and our community. So we really want to listen to our community and understand what it is that they feel, or where they feel Mātai can add value. We have the challenge of making sure we're sustainable. So we need to know that in 2, 5, 10 years from now, Mātai will still be here. So we've got some work to do around making sure that we continue to be sustainable. Back to collaboration, what I've just talked about, ensuring that we've got equitable outcomes and that what we do in research translates well into clinical practice. We want to make sure in terms of research and innovation, we remain cutting edge to the latest technology. We want to make sure that we've got the experts here to help us do that meaningful research, and we want to provide a continuous learning environment. I think COVID taught us something important about preparedness, and Samantha and I thought it was fitting to have that as part of our, as one of our priorities. And I'll talk about the next generation shortly, but we certainly want to make sure that we're preparing for our next generation. We want to make sure that we are looking towards a research centre of excellence, and we really want to make sure that we're impacting that prevention space, and we also want to go one step further and look at precision medicine. So one of my first jobs when I joined Mātai was to go out and procure for a 3.5 Tesla MRI machine. So Samantha, myself and Dr. Daniel Cornfeld, we packed our bags and we travelled the world, literally around the world, to look at the cutting edge technology with a couple of pretty big international medical imaging companies. It was a fantastic opportunity to see what was out there and to meet and collaborate with people doing really fantastic research around the world. And as part of our procurement, we wanted to make sure that the vendor that we selected firstly understood our vision, and secondly wanted to be part of our Mātai whānau to ensure that we achieved that vision. We wanted to make sure that that company could collaborate us not only nationally, but internationally. Samantha will talk about some of the research that she's been involved with shortly, but for example, she's worked in Stanford University. We wanted to make sure that we had connections so that we can, again, work towards that impact research and not be repeating what others are doing around the world. The other thing with our procurement is we wanted to make sure that we had access to products that aren't yet commercialised, and we wanted to have the opportunity to try other products around the world here at Mātai. So sort of that two-way, they try our products, we try theirs, and let's try and make this whatever change that might look like, let's make this happen. We ended up in a situation where it was really difficult to choose which vendor we wanted to go with. They were both incredibly keen to be part of the Mātai whānau. And through our procurement, we ended up with something that was quite unique to New Zealand. We ended up with our own GE Healthcare scientist. And I've just said GE Healthcare, so that's obviously who we selected in the end. And we ended up with approximately a $6 million solution for just over $3 million. So thank you to GE Healthcare. And so without further ado, I want to introduce you to our Lamborghini. I like to call it that because it is Lamborghini in terms of 3T MRI. It's high end for brain, heart, body, and musculoskeletal. And the other key point here is it doesn't use radiation, so we can do our research safely. So let me just... Yeah, I think it is because we've got... It worked when we tested it. Yeah. Maybe we just talk over it. Oh, I'd love to show it. Okay. Matthew here? Matthew here? I think it's okay. Slowly.
And the TV's not on. Great.
just on that note, I've actually got Mark here with me from GE Healthcare because of our big milestone this morning, and he's just going to quickly talk to you about some of the latest technology.
So on the video, you saw a little bit about the NFL players running into each other and crashing their heads. So we developed the air technology in conjunction with the NFL to study concussion and its impact in the field. So the design of the air coiled elements is a complete innovation in the industry. And it's moved from etched copper, sort of like you see on circuit boards, into a new technology called Inca loops. These Inca loops are flexible for the first time, which allows us to fold a coil. This is the real coil, right? This is something that's not done in the industry, in the marketplace, which means the coil can actually conform to a patient. So when I put this over the top of Lee, it's a very, very lightweight coil, and it has a really large coverage. So this is not abnormal, but Lee, if you put your arm out towards me, for the first time in the industry, I can actually wrap this around and I can actually overlap it. Now, if you do that on a traditional system, you'll lose images. You won't actually see any information in the middle here because the coil elements will nullify each other and you won't get any picture signal coming out. So this is a complete revolution and change in the imaging industry. It's also lighter. It's 60% lighter than the previous technology. So when you have your little kids come in for a scan, right, they feel a lot more comfortable, which means they're a lot more compliant. The imaging's faster and the image quality that comes off is better. When we were talking about the NFL before, the coils, the same coils that are in here are also in the head coil that the team have got for all the brain research that's going to go on. And it's specifically designed as well to accommodate large heads. So that actually has a 3 centimetre spacer that we can put into it that increases the size of the types of heads that can go into it. So we end up with around about 98, 99% of heads in the world can actually fit into those coils, which means that your number of research subjects you can scan is increased. And once again, their comfort and compliance is increased as well. So that's a little bit of a sneak peek of some of the technology in the system, but it's fantastic to have this here in the country and with the team. And thank you for letting us be part of the journey too.
I just want to quickly talk about having this sort of technology and how that might benefit a remote area. So I was fortunate to work with Dr. Daniel Kornfeld at the DHB, who spent some time at Yale doing some prostate research in prostate. And because we have this technology here in Tairāwhiti, he is working on how he can flip a clinical model on its head. So if you need to see a urologist in Tairāwhiti at the moment, it's very difficult. It's a very small workforce, and we have to bring someone from out of town into Tairāwhiti. And what Dr. Kornfeld is working on is how can we use the technology that we have, in particular some of the machine learning, to stratify or to prioritize who actually needs to go and see that urologist. So, quick example, you would go through the hospital system, you'd see your GP actually first, you get referred to a specialist, you would then meet the urologist who will then refer you for imaging. So we're looking at how can we change that so that you come straight to MRI. We run some methods on our scanner and we can tell the patient and the doctors whether they actually need to see a urologist or not, which means that those that need to be seen can get seen quicker. And one last thing around Mātai's goal of precision medicine. I've just seen that I've missed that there. One of the things that Samantha and I are looking at doing is building an artificial intelligence team and looking at machine learning. And the idea is that we want to see in the future that Mātai is able to be predictive of disease, so that we are able to get data, imaging data and from other associated systems, pull that together and look at a way of predicting that someone might be at risk of of a heart attack if they don't change something within the next couple of years. So that's another area we want to look into. Going back to the clinical and research teams working together, we think it's very important that we are based at the hospital, and we want to make sure that our clinicians feel welcome to come and talk to us about some of the things they're seeing in clinical practice, and start working on how we might improve that through Mātai and the research we're doing there. Another important point, I think, is that Mātai is offering the opportunity to also attract specialists to this town, and also, importantly, making sure that we retain the people that we've got here already. So for the first 2 years, we have got a temporary modular at the hospital, and you saw that earlier with the MRI actually going into the module. And we'll also be based at 400 Childers Road. One of the first things Samantha and I did was we went out and bought a really nice coffee machine when we first opened our doors. So if you ever want to come and have a cup of coffee with us and talk about some of the things you'd like to see Mātai getting involved with, please do that. 400 Childers Road, you'll find us. Oops. And lastly, just something else that I'm passionate about. Being Māori and being in radiology was quite a lonely experience. There is very few Māori practicing in radiology, and I also understand that reaches to the STEM, anything sort of STEM. So I am looking at, with some of my colleagues, about how do we build a pipeline so that our rangatahi can ensure that they've got the grades that they need to get into these courses at university, and also look at how can we support them to study here. So there'll be some conversations that we need to have with some of our universities. And my colleague Jeanette's going to talk a bit more about how we might encourage and inspire our tamariki to look at careers in STEM. So without further ado, I'm finished. Hand you over to Samantha. Thank you, Lee.
Good afternoon, everyone. Thanks to Trust Tairāwhiti for the wonderful opportunity to speak with you today. So I'm going to talk a little bit about some of the research and technical development that we're going to be doing at Mātai. In fact, a lot of the stuff we've actually started working on. We've been working on it for a few years, just in the lead up to Mātai being established. So I'm just going to give you a few examples of some of the things we plan to do and we're very interested in delving more into. But first up, I just want to give you a little idea, a little sense of the types of things that MRI can do. So this is an example of a brain image. So you're looking kind of from the top of the head, you're looking down on the head, and what's called an axial slice here. So this is a normal brain. Here you see the ventricles here, you see the brain tissue, you don't see anything wrong with this brain. But if you look at this one, you can see a large tumor. This is another example of someone who has had a motorcycle accident. They've had severe frontal lobe brain injury. You can see this sort of massive lesion here and a blood clot there, a blood hemorrhage there. This is an example of a stroke. MRI is very, very good at picking up stroke. You can see this very bright lesion here, or it's called an ischemic lesion. And this is another example of a block of what happens if the brain is blocked. If the brain is blocked, what happens is these ventricles can start to expand, and you can see the fluid fills this space here and starts to kind of push the tissue to the edges of the brain. So these are sort of quite sort of very, these are very sort of unsubtle images where you can see sort of gross lesions or gross changes in the brain. But there are also many other applications of MRI looking at more subtle injury. We can also do advanced imaging of the vascular system. This is an image of the vessels of the brain. You can see the nose here, you can see the ears, you can see all the veins and arteries in the brain. This is actually an image that was acquired back at Stanford, where we injected some contrast agent. You can see every part of all the vessels, almost all the vessels light up. And I'm going to play it again because what you can see here is this again is a pathology. You can see as you rotate around, you can see this bird's nest of vessels just here, and what that is called is a vascular malformation. That needs to be cut out. So MRI is very, very good at allowing us to sort of see what the problem is, and also helping to guide neurosurgeons as to where to cut these types of things out. This is another example of more advanced MRI where we can see the wiring of the brain. So these are like the phone lines in the brain that send information around the different regions of the brain. You can see this axial slice here, and you can see these wiring coming up through the brain. This is a sort of 3D rendered view here that was reconstructed by Leo, who's a Mātai research associate right there. And so this gives us an idea about, you know, what the sort of integrity of these wirings of the brain. It opens up all sorts of applications for understanding things like neurodegenerative disease, all sorts of different neuroscience applications as well. Taking it one step further, we can also do something called functional MRI. Now, functional MRI is a way of looking at the cognitive processes of the brain. So what you do, if you go into a scanner, and you can volunteer for some of our studies, you can go into the scanner, you can do some kind of task. In fact, you don't even need to do a task. You can just lie there and think of nothing, and your brain is going to light up. It's going to be, something's happening in your brain all the time, and we can actually measure that. We can indirectly measure the cognitive processes that are happening in the brain using this thing called functional MRI. This is work that we did back at Stanford, where we got people to lie in the scanner, and we scanned so fast that we could pick up actually what was happening dynamically, in real time what was happening dynamically in the brain as you think. So I've been very focused on the brain because that's my expertise, but of course the MRI Lee showed you can do all sorts of different things with imaging. You can look at the heart, you can look at the liver, the kidney, the musculoskeletal system. And this is an example of an image of the heart. You can see the heart beating here. You can also get these beautiful images of the flow. You know, what's the flow, the extent of the flow in the heart, the flow direction, gives you an idea of this fine structure of the heart, its tissue itself, as well as the vascular architecture around the heart. So these are just some examples that kind of gets your eye into what MRI can do. But I'm going to delve a little bit deeper now as to what we're really specifically trying to do at Mātai with some examples, just a few examples of the types of things that we're going to be working on, at least initially. So there's 5 examples. Lee's already touched on one, which is the prostate cancer project. We're also building up research teams around trying to understand heart disease, get early biomarkers of heart disease, because in Tairāwhiti we experience the highest rates of heart disease in the entire country. And so that's an area where we're going to be growing. But I'm going to focus on these other 3, the concussion, the Tairāwhiti study, and new MRI methods that we're going to be working on. So when we turn the machine on, we're going to be really ready for concussion research. So we've been doing a lot of foundational work in concussion to build our knowledge in this area. So in the last 3 years, in part due to my role at the University of Auckland as a senior lecturer there, we have been pulling together a multidisciplinary team to understand the mechanisms of concussion, come up with early tests of concussion, and we've pulled together through the Centre for Brain Research and with collaborators from the Auckland Bioengineering Institute, quite a diverse team that spans imaging all the way to molecular biology, to machine learning, to clinical biomarkers, a huge team that all are working together on trying to develop tools for concussion. I just want to shout out to Dr. Erin Kwan, who's a senior research fellow at Mātai, who has been really the glue of our multidisciplinary team. And now she's helping to implement our concussion research program at Mātai. She's been doing her own research to do with, her background was in cranioballistic modeling, what happens when you get shot in the head, what actually happens to the back. It's quite full on, but it's what happens to the blood on the wall as if you got murdered, basically. So she can inform forensic scientists on what to do. So we've recruited her. She's right with us at Mātai doing this work in brain injury simulations. So when we turn the machine on, we're going to be doing research led by Dr. Patrin McHugh and some of the Mātai staff in collaboration with Tairāwhiti Health, GE, Auckland Uni, and we're working with Gisborne rugby teams to find an early test for concussion using imaging and other tools. And soon we're going to be doing a pilot study using these sensors from a company called HitIQ. Now, what this company make these mouth guards that can be fitted, tailored to the participant, and they have these little sensors that are embedded inside the mouth guards that can very accurately measure the impact of the head as you get hit in the head while you're playing high-risk sports. So what our goal is to supply as many teams as we can, particularly the young ones, the 16, 17-year-old rugby team players, and start collecting this type of data from the rugby field. And combining this HitIQ sensor data with the imaging that we're going to be doing, the advanced imaging from our MRI machine, that's going to allow us to simulate brain injury, to understand the mechanism, how much damage has occurred, and help guide us on how to manage concussion. And we've been doing some preliminary work in conjunction with the Auckland Bioengineering Institute. This was kindly just hot off the press from Vicky Shim. We've just had an article accepted in IEEE, which is this is a simulation of what happens when you get hit in the head. You can see the brain strain changes, the stress and the strain changes as you get impacted into the head. And this has actually been simulated based off data acquired on American football players. And what Vicky has managed to do is to create an algorithm that very quickly allows us to simulate what happens to the brain under this type of impact. Normally, this type of simulation takes hours. She can do it in a minute. So the goal is to use brain imaging from our scanner to come up with accurate algorithms that can be incorporated into these sensors. And this is just one example of the types of thing that we're keen on doing we will be doing at Mātai. This is another example of some of the wonderful work that one of our research assistants at Mātai, Dr. Matthew McDonald. Matthew's actually a doctor, medical doctor too. He's an eye surgeon and a PhD candidate. And so just a little bit of a background here is the eyes really act as a window to the brain. So the eyes are connected by nerves that run through to the back of the brain. And so that any form of brain trauma is going to reveal itself through through changes in eye movements. And so we're going to be really testing different types of eye movements in participants to tease out where damage lies in the brain. And by using our new machine, we're going to be able to learn more about these types of eye processes that are occurring as you get brain damaged. And so the goal of all of this research is for Matthew to come up with an affordable, portable diagnostic concussion test to patients. And Matthew's already got all the ethics to do our project and getting this project off the ground. And he's actually also got his little kit here as well. This is his portable eye tracking device, which is a novel device. And he's happy to show you all, anyone who's interested, to show you what he's doing after the talk. So just another example of the types of things that we've been working on. I just want to talk a little bit about one particular MRI method, just to give you some context of the types of things that we're keen to do, is this method called amplified MRI. Now, this method was developed, I developed along with my team back at Stanford, but we're pushing this method even further here at Mātai. And so just a little bit of background. The inspiration for a method, once upon a time, came from when I was sitting together with my colleague back at Stanford, and we were watching a TED talk which showed us a real world video, and it was a talk from MIT where they developed an algorithm that they could amplify this sort of subtle motion of the brain. Now, every time the heart beats, the head kind of, you can't see it, but your head is sort of wobbling around like that. It's just wobbling around a very small amount, but it's kind of going like that. And so what these guys from MIT did is they were able to use this algorithm to amplify this very, very subtle motion so you could really, really see it. So when we saw the video, we thought, this can be applied to MRI. We can get MRI type movies. Why can't we tailor this algorithm so that we could amplify the subtle motion of the brain as a heartbeat? And sure enough, we ran up, we scanned each other, we came back down. A day later, we had this. So what you see, this is what you actually see on an MRI, what's called a dynamic MRI, which is a series of very fast videos of the brain. But you can't see that motion because the resolution of MRI isn't quite big enough to be able to visualize this very, very subtle, what's called subfocal motion. So by taking this algorithm, tailoring it a little bit, tweaking it, we amplified the motion to an amount that you can really see the brain deform with the heartbeat. And this opens up all sorts of interesting applications, clinical applications, such as what happens when the brain is blocked. The brain is blocked, the brain motion is going to change. And that can open up applications for all sorts of things like hydrocephalus, something called Chiari malformation, which is when their cerebellum here drops and blocks the flow of the fluid around the brain. So we immediately saw the potential clinical application. And since then, we've been working with my old student from Stanford University, Itamar Tarem, and Leo, have been working on extending this algorithm to 3D so that we can see the motion in 3 dimensions. This is actually the first time we've ever shown this. Is just hot off the press. Leo just sent this to me the other day. This is a visualization of the fluid, the motion of the fluid in the brain. This one here is Leo's video showing how if you overlay these vectors called optical flow vectors, it can allow us to see this motion of the brain as the heart beats. So one other obvious thing that some of you may have worked out already is that if the brain, you could probably think, if the brain is under high pressure, I mean, there's lots of diseases that cause the brain to be under high pressure. Traumatic brain injury is one of them. There's other ones like intracranial hypertension, hydrocephalus. So when the brain is under high pressure, you would expect that the brain would move in a different way. And we've already demonstrated some of our preliminary data back up in Auckland. We've already demonstrated that this is perhaps the case, but the next steps are for ours to validate this in human studies. Here, we're going to see if we can use this very non-invasive 5-minute 3D amplified MRI method to be able to avoid the need to drill a hole in the head, to place a shunt to measure the brain pressure. So there's a potential, so very quick non-invasive test that can potentially remove the need for invasive brain surgery. So this is something that Mātai is going to be working on and continuing to develop. I just want to, the last slide that we've got with regard to study is on the Tairāwhiti child wellbeing study. Now, just going back a bit, after all these years of doing research at Stanford, what I've really come back to Gisborne to find is that really there's a lot that's missing, in the sense that we often look at the body in silos. We often look at the brain in a silo, we look at the heart in the silo. But really, as we all know, is that the body is connected in many different ways, right? If one is affected, the other organ is obviously going to be affected. And the other thing that really sort of dawned on us is that we're really lacking normal data. We've got a lot of pathological data that we have access to, but there's just not enough normal data for us to understand what normal looks like. And so what we are going to be doing, as soon as the scanner arrives, we're going to be scanning 10 kids. We really believe we can do this. We can scan 10 kids, 50% Māori, 50% non-Māori, with a 45-minute exam. Because we've got this amazing technology from GE, we believe we can get a 45-minute exam from the head down to the pelvis, where we scan the brain, the heart, the vascular system. We can do functional MRI, the liver and the kidney. And so we gather this data and we scan kids for the rest of their lives, including when they have a major health event, so we can build up a database of what normal looks like. Now, if we have such a database, we can now look into how do we prevent and predict diseases earlier. I'm just going to say that there's a boy called Arthur in the front row who is very kindly offered to be one of the first kids in the MRI machine. So very excited about that. Just another little mention here. This is an image of the structure, but you've got overlaid the function of the brain on top of that as well. I'm just going to leave you this last slide, and it's because I just got sent this by one of my PhD students called Miriam from the Auckland Bioengineering Institute. So Miriam has just been amazing. She's working on a lot of our projects. She's going to be doing a lot of the image processing on our concussion projects, and she's a bit of an expert in looking at the wiring of the brain. And she just sent this image to show, look what I've done. I've created this image which is inspired by the Pahutakawa. So normally you would never do this. You'd never create an image that looks like this, but she's managed to kind of tweak it a little bit. So she's created a brain image that looks like a tree. So I thought I'd end on that lovely, lovely picture. And with that, I'm just going to hand it over to Jeanette, who's our wonderful Head of Ventures and Communications, to talk a little bit about some of the community outreach programs that we've got going.
Okay, so we're doing a lot of really great research at Mātai, but we're also really passionate about inspiring our kids, you know, just helping them build skills and opening up their minds to all sorts of different areas that they can look at for their futures. And some of the ways that we're doing that is by setting up a range of activities, but we're also very open to schools or parents or anybody coming to us to let us know what they think might help and inspire our tamariki. So I'll just quickly take you through some of the activities. So we're happy to get out and talk to schools, whether it's talking about our journey or teaching them about brain science or MRI or sort of different medical areas. And another thing that we're doing, so essentially the MRI is a giant magnet. So thanks to Mihi Hana and the House of Science, we have this great magnet pack here that teaches kids all about how magnets work and magnetic fields, so the fundamentals of MRI. And there are loads of little hands-on activities that you can all come and have a look at later if you like. We also have the opportunity to set up a little robot workshop where intermediate kids can get involved in soldering and then code a small robot. That's a one-day workshop, so we're just talking to schools at the moment. And that's supported by Erin Kwan, who you saw earlier. She's our research fellow. And there are all sorts of educational opportunities out there, and we're here to help where we can. One example is Being Brainy. That's a set of educational activities for primary school kids that, and those are free resources that can be downloaded, and Mātai can come in and help with talks or talk to the people in Auckland and get them to come down and help out with a few hands-on activities there. The New Zealand Brain Bee Challenge. This is a really great way to encourage kids to go into brain sciences. So it's a competition, and if there are any sort of year 11 kids in the region who are really keen on taking part, we're going to look at whether we can provide special tutoring for those kids, and we might also be able to help with some of the costs where needed. And another exciting item, we've got a Mātai scholarship coming up soon. So this will be available for a high school student who wants to go off and learn all about medical sciences or even engineering, if they plan to take that through to a pathway in biomedical engineering, and as well as imaging. So details on that will come out very soon. And as another part of our outreach, we're doing a brain and heart event at this year's AMP show, It's going to be lots of fun. You're not going to miss us because we're going to have a giant brain out front, and we'll be right beside the Cancer Foundation's giant colon. So this will help you understand different diseases. It'll show you how normal brain works as opposed to a diseased brain, and it also comes with a brain expert, so you can come along, go for a walkthrough and ask any questions you like. And so at the AMP show, we're going to have a great big marquee with loads of sort of activities related to the brain and heart. We'll also have a few details there about our research projects, so you can come and talk to us all about those. Yes, it'd be lots of fun, and we expect to see everybody there. And the last thing I'm going to talk about briefly is 3D printing. It's because Leo, our research associate, is a little bit of an expert there. And we might do a workshop on 3D printing at some point if we find that there is demand from the community. So 3D printing is a really cost-effective, quick way of producing parts and accessories and all sorts of things across a whole range of industries. So we've got some examples here. It's used all across medical industries and music, all sorts of different parts. You can use it in farming. Got a few examples here that you're welcome to come and have a look at later if you like. And where MRI comes in, the images taken from the MRI can be used to reconstruct all sorts of body parts. And so surgeons can also use those to do a bit of a practice or just for learning. And it's also used now in the Auckland and Christchurch hospitals just as a cost-effective, quick way of printing medical parts. And so if anybody's interested in that, Leo will be available later to have a little chat if you have any questions. And so that's all from me, and just feel free to come and talk to me afterwards about some of these bits and pieces, and Mihi might want to help out as well. Okay, so I'll leave that into you.
Really come up and actually pick these up and look at them is quite incredible, this technology. So it's an example of a little baby cast right here. Just one last thank you very much. Really appreciate that you came here to listen to us. I see lots of familiar faces, and really appreciate that you took the time out of your day to come. And particular thank you to Trust Tairāwhiti for all their support, for inviting us, and for the incredible support in terms of guidance, advice, and also support right the way from the last 3-4 years, as well as their funding towards the initiative. Really appreciate that. A special thank you to all the people here on the acknowledgement list here. It's just wouldn't have happened without everyone, as well as all this community encouragement as well from the people here. So really appreciate it. Thanks.